Welcome to High Tea with Grace, where we spill the tea on HIT. I'm thrilled to be here at the HIMSS conference interviewing the industry's greatest leaders about trends in the space. So tell me, who are you and what do you do?
Hi, Grace. My name is Dr. Sari Green. I am Physician Executive Director with Accuity, General Surgeon by training, and now working in the middle revenue cycle space.
Fantastic. So, what is Accuity?
So, Accuity is a company that partners with health systems in the middle revenue cycle, basically the last stop before that chart goes to billing. To help make sure that hospitals are appropriately reimbursed for the care that was provided and that the quality metrics accurately reflect the complexity and acuity of the patients that they're caring for.
Fantastic. Now, what trends are you hearing in the HIMSS hallways?
There is so much talk about AI in all aspects. I'm really kind of focused on within the middle revenue cycle in general, and middle revenue cycle. A lot of discussion around kind of automation and efficiency, and also really the importance of governance. And in our space, I think in healthcare in general, that's especially important. To ensure that we're using it in the way that it is intended at this time, which is to kind of surface patterns, identify gaps, and really work as or be used as a support for the experts to help their judgment, but not to replace it.
Terrific. Now, I know a lot of folks here at HIMSS are talking about health equity, and I'm interested to hear about what you feel to be the most underrated kind of health equity challenge in healthcare right now.
You know what I'm really interested in right now is the kind of ever evolving conversation around hormones for women. I have a really close friend who is really at the forefront of this. There's a small group of women physicians who are really kind of pioneering this effort. They call themselves the menopause. Because there's been, really conflicting and narrative around this. And in my generation of trainees, we just learned that hormones were dangerous and bad, right? And so, it's something that spans kind of this disparity spans, all different areas. So it's kind of mental health, cardiovascular health, bone health, and a lot of clinical physicians at this point are, feeling kind of underprepared in really addressing it. And so it's just been really interesting over the past several years to see kind of a deep dive into the research, and, the disparity in research around women's health. And it seems like we're slowly making headway there.
Snaps, girl. I couldn't agree with you more. Thanks for calling it out. Now, we have a lot of young people here at HIMSS, and they're looking to get into health IT similar to yourself. What advice would you give them as they're kind of entering their career into this space?
I think in general, as far as career paths go, I've taken a really circuitous route. And I think I always thought this, and now that I'm older, I really, really believe it. And it's borne out that if you follow kind of what you're interested in and what your passion is, and even if it doesn't necessarily look like where you're headed, but kind of take that next step and that next opportunity in the right direction, amazing doors open up that are kind of beyond what you ever could have had envisioned.
Oh, I love it. Great perspective. Thanks for joining us today.
Yeah, thanks for having me.